Okay. Hi, everyone. I'm Alexis Williams, founder of Business Skills for Health Professionals, and welcome to the Beyond Clinical podcast. In this podcast, I'll be interviewing health professionals from diverse backgrounds who've moved into unconventional roles beyond clinical. We'll be hearing their stories and tips and hope that this inspires you to pursue unique career paths. So, this is actually episode 22. And I'd love to introduce my guest, Timothy Lau. Timothy, do you want to say hi to the audience?
Hi, everyone. Thanks for tuning in today.
Yeah, thanks for being a guest. I want to share a little bit about your background. So, Timothy is a driven and successful young leader in healthcare. He currently works as a senior consultant with the Strategic Transformation Team at Fraser Health Authority in British Columbia, which is in Canada, and is an expert in project management and change management. He holds a project management professional PMP designation and an MBA from Simon Fraser University. Prior to making the leap into healthcare business, he served as a clinical dietitian at Vancouver General Hospital. His other accomplishments include serving on the board of directors of Dietitians of Canada, being published on a nutrition database with his research reaching hundreds of health professionals across three continents, and having received nationwide recognition and awards for his contributions to dietetics and the greater community. Outside of work, Timothy enjoys hiking, camping, skiing, chasing sunrises and sunsets, and essentially doing anything to do with the outdoors. And he's also an avid hockey player and fan. Awesome to hear your background and some of your hobbies that we share. We were talking about skiing before we started recording today. We're both looking forward to hopefully a snowy winter in Canada for some good
Sure.
skiing.
Yeah.
So awesome. Yeah, so I just like to ask kind of a fun opening question. And the one I'm asking right now is about podcasts. Do you have any favorite podcasts that you love listening to?
Yeah, not gonna lie, not a huge podcast person, other than yours, of course, Beyond
Good
Clinical. So,
answer.
yeah, exactly. But one other one that I tend to tune into is serial killers. For some
Oh,
reason, just on that serial killer bandwagon, podcasts, Netflix shows, all the Ted Bundy, the Zodiac killer kind
yes.
of thing. So, yeah, hopefully that doesn't say anything weird about me, but
No, those are
it's
super
a fascinating
popular.
little listen. So yeah, yeah, yeah.
Oh, that's
So yeah, I
awesome.
can I can tell it's it seems to be blowing up. So hopefully I'm
Yeah,
not the only one super interested in it.
I love it. I love it. Yeah, so I'd love for you to just kind of talk high level about your journey, your career journey, and kind of how you got to where you are today.
Yeah, for sure. So yeah, I was born and raised in Vancouver, BC, Canada. Would say I got interested in becoming a dietitian quite late, maybe in the latter part of grade 12, around 2 weeks before university applications were due. So yeah, I knew I wasn't quite smart enough to be a doctor, so I was kind of looking for other alternatives, in the science field, and came across yeah, the world of dietetics, where it really spoke to me of I enjoy living a healthy lifestyle myself, and I enjoy helping other people. So let's give it a go. So yeah, I did my 5 year dietetics degree at the University of British Columbia. Um, Worked for a few years, as you said, at Vancouver General Hospital as a clinical dietitian. Then I decided to go back to do my master's, as I was kind of hoping to, yeah, I think develop my skill set and see what else the world has to offer in terms of my professional kind of contributions. So I did my master's in business administration at Simon Fraser University in Vancouver. And then, yeah, the rest is history. So, yeah, I've been on my current about 2 years now, and in my current role um, for about 6 months or so as a senior consultant. So, yeah, I'd like to say that, or I'd like to think that I've, yeah, been able to get some good experiences thus far, and it's been a good journey, but obviously still lots to still learn.
Yeah, for sure. I have one clarifying question. Did you do your project management training as part of your MBA or was that outside of it?
Not much during the MBA. I would say there, at least in my program, not too much project management specific training or courses. But I actually kind of just stumbled upon project management kind of in the latter part of my MBA, where I started to network with some project managers and kind of understand what the field's all about. And yeah, decided that's the avenue that I wanted to try and take as project management within the healthcare space. So.
Awesome. Yeah, I know that's an area that a lot of people I speak with who are looking at career changes are really interested in. So I'm sure we'll probably talk a little bit more about that. But is there anything that kind of stands out to you that's contributed to your success in business?
Um, Yeah, definitely. I think it's important first and foremost before answering the question is to define business. I think if you do a quick Google search and it'll tell you that business is selling a good or a service for the purposes of making money, essentially, right? And to me, I think business is a little bit more than that. I think, you know, um, ultimately businesses being able to serve and advance in organizations systems and processes ultimately to improve their services that they're able to provide for their clients or for in my case for the public and in healthcare, right? So I think this avenue of business maybe is a little bit less traditional in the business sense, but at the end of the day, I think there are a lot of things that I, as a former clinical dietitian, had to kind of learn, right? And
Hmm.
to do that, just a sense of passion and that desire to learn, right? Anytime you make a career switch or go into a master's in business, where I really had no business experience, really had to be a sponge and soak in everything that I could and get used to new ways in thinking, new ways in terms of uh, information, new tools and new methods and processes that you have to learn. I think we're trained as a dietitian to be effective in what we do, but obviously, there's there's a another aspect to many um, things that you have to do in to be successful in business. So yeah, I think that's just the biggest thing is being brave and putting in yourself in situations that ultimately will stretch you, but you're going to be better for the you're going to be better at the end of it. So yeah, nothing really too complex, I'd say. Just yeah, you
Hmm.
really got to be passionate and work through the hard times during while you're making that shift.
Yeah, and I like how you kind of at the beginning talked a little bit about the expansion of maybe what clinicians might be thinking about when they go think about, transitioning into like a business. Like it's not just working in for profit. You can also expand your thinking and opportunity within like here in Canada, like the publicly funded health system into more of a different role within your organization that maybe does require more business skills, but still keeps you in that healthcare sector if that's something that you're passionate about. So I think that's one of the reasons I wanted to have you on here is just to kind of give people different ideas and opportunities for their career. So
Mhm.
thank you
Yeah.
for talking about that a bit.
No,
So,
absolutely. Yeah, I think it's, to your point further, it's scary sometimes when you hear the word business,
mhm,
right? Especially when uh, you do no business courses throughout your undergrad. But I challenge anyone's perspective of what business truly means, right? You may
mhm,
think of an accounting spreadsheet or doing cost benefit analysis or something like that, just something that seems super daunting. But really, there are other skills that you can leverage as a clinician to be able to be successful in terms of ultimately providing value to your organization outside of
mhm.
what uh, maybe an accountant or a financial manager would do, right? Stuff that we
Right,
typically think of the word typically the things that we think of when we hear the word business.
right.
Yeah, yeah, good
Yeah.
point.
Well, and you bring so many useful like exposure to clinical environments when you go into these roles too. And I think we can't take that for granted that there's a
Sure.
lot of value that a clinician will bring to maybe like a leadership or project management role within a healthcare organization, just kind of understanding what it's really like working in different environments within that organization. So
Right.
I think
Yeah.
that's really important as well.
Mhm.
Yeah. So what has been the role of like mentors, maybe coaches and different communities in your career path?
Yeah, I haven't used any coaches. And as for mentors, hugely beneficial. I wish I could say that I've utilize mentors a lot longer than I currently have. I'd say I've really only been able to take advantage of having strong mentoring relationships within the last couple of years. But I think it's kind of important too when how you define a mentor as opposed to networking, and that's something that I think I got kind of confused for the past 5-10 years of my kind of professional life, right? And I would say a mentor is someone who is willing to obviously invest the time in you and nurture you, and I think most importantly is able to, I think, provide the opportunities for you to be able to challenge yourself and for you to grow, right? And those opportunities, that could be like an actual opportunity, a paid opportunity, a role, or it could also be something like the opportunity to do case studies with you on a monthly basis or something like that, right?
Hmm.
And I think when I was looking to make the switch, I should have sought out mentors a little bit more for those opportunities. I did a lot of networking, which I thought, it is helpful, but networking in my mind is more so, you have a conversation with someone, you learn a little bit more about them and what they do and their company and or their organization, and is more kind of informational kind of that way, right?
Hmm.
So I did a lot of networking, but didn't really seek out a lot of mentors. So I didn't really have a lot of the opportunities to practice the skills that I needed to develop in order to be successful in business, right? So, um, yeah, I'd say, as I started to value mentorship opportunities a little bit more, yeah, those opportunities to stretch myself has started to present a little bit more, right? Some that I do at work, some mentors are at work, and they can say, what, I have a new project that I need you to do. This one's going to be really challenging. I'm
Hmm.
here to support you as needed, but here's the keys to take the reins on them, right? So though that has been you know some invaluable learning experiences right there, right? And there's
Hmm.
also mentors that I try and keep in touch with outside of work, right? So as I said, being able to run kind of case studies through them to get a different perspective of someone outside the organization, right? Hey, what would you do
Hmm.
in this scenario, right? Given X, Y, and Z. So yeah, so mentors, I would say they're a huge um, opportunity for you to be able to, grow yourself and grow the skills and the confidence that you need to be successful when making a career change.
Yeah, for sure. Yeah, and I think it's interesting how you saw that shift of like the networking and it can be a little bit more transactional, whereas
Hmm.
mentors are kind of there really guiding you along that path.
Right,
And they're often within an organization, but you can find them outside of organizations too. So,
for sure. Yeah.
yeah, I definitely would encourage people to look for those opportunities wherever available because they can really be beneficial if you want to grow within an organization. And I certainly benefited from lots of great mentors during parts of my career as well. Um, did you run into any kind of knowledge gaps when you moved into your role? And I mean, I know you did do like a formal MBA and some certifications, but was there anything that you still ran up against in that transition?
Yeah, absolutely. I think, as with any transition, you're never, even now, right? 2 years into the role, in project management and in change management, there's still a lot for me to learn and to upskill. But I would say when I was moving from, clinical, frontline interacting with, patients and healthcare team, members, on obviously on the daily basis, right? I think the way you interact with them is a little bit different than the way that you may interact with others in a, I guess, more corporate setting, right? So, that I think the ideas that you have to communicate, or some of the challenges or the risks that you have to communicate, for example, in a presentation, or if you're delivering a report, that requires, a special way to communicate that, right?
Hmm.
Whether written or verbal. So yeah, there's a lot of soft skills, such
Hmm.
as those examples I just mentioned, that had to take some time to get used to. Even other um, non-hard skills, for example, like understanding healthcare itself, right? I
Hmm.
think when you're when you're working in the hospital, like I was, then you are exposed to a lot of the clinical side of things, but obviously not a lot of the other operational, funding, unions,
Hmm.
um, relationship of the organization to the Ministry of Health, and how that intersection all works and whatnot, right? So there's a lot of I think kind of a broader kind of strategic lens that you kind of have to develop once you move into a more business or a more corporate role. That
Hmm.
I think there's no great way that you really learn it other than asking questions and yeah, just trying to observe as much as you can, and connecting with those who do understand a little bit more about it than you do. So
Hmm.
yeah, I think there's also more of a political nature as well to more
Hmm.
business and corporate roles too, right? So yeah, just a lot of
Hmm.
things that I wasn't really expecting. I was able to take my clinical knowledge to my current role, which obviously
Yeah.
is gives me a huge bonus. But yeah, on top of that, there's a lot of soft skills and understanding kind of the landscape of the
Hmm.
sector that I'm in, which is public healthcare, right? So, yeah, a lot of those soft skills, hard skills, and those kind of political kind of things that you kind of have to get accustomed to.
No, I think that's a really important point that I do a lot of coaching around is helping people understand, like, if you're trying to get into a sector or, grow into a company, you have to really ask a lot of questions, as you said, and really understand, like, the model, the business model, whatever it could be called, a business model, but
Mhm.
just understand, like, all the moving parts and how it operates, who its customers are, like revenue, all of that. Those aspects are really important to, I think, to just start to lean in on if you have the desire to grow your career into more of like a different type of role. That can be really important to have an understanding of. So I love that you mentioned that. And I think, yeah, asking questions is the best way to find that information.
Mhm. Yeah, totally.
What do you love most about what you're doing now?
Yeah, to be honest, it's some people get a chuckle when I say this, but my favorite part of my job is that all projects have a start and an end date, right? So I'm never
Hmm.
working on one thing, for more than I'd say a year or two, right?
Yeah.
And because I can get pretty bored, to be honest,
Hmm.
at work at sometimes, but when you switch up the projects in terms of what you're doing, who you're working with, what area within the organization you're working in, that gives you, I think, it gives you a challenge, but B, it also allows you to, see other areas of the organization and work with other people as well, right? So, instead
Hmm.
of the same kind of day in and day out job, it feels like, it's every project is a little bit more dynamic in nature,
Hmm.
right? So yeah, I think that's one of the best kind of aspects to project management, if you're willing to, if you're okay with that, the fact that things are kind of always changing, right?
Yeah.
um, and I'd say, I knew I wanted to stay in healthcare, and I do have uh, a lot of close friends, obviously, who are clinicians, and my favorite thing still is to to be able to do projects that ultimately have a great impact on clinicians and making their lives a little bit easier, so
Hmm.
that they can better serve the patients, right? So yeah, in my job I get to once in a while connect with former colleagues, or clinicians. You get to I get to connect with yeah, a lot of dietitians here and there while doing my projects. So yeah,
Yeah, it's
I get a
cool.
good yeah, I get a good chance to yeah, work obviously, but also work with other members within the organization, such as dietitians. So, yeah, and I'd say probably the other thing is just the impact that you do, right? I think
Yeah.
if you the impact in terms of being able to plan and implement a project which has regional and maybe sometimes even provincial
Mm-hmm.
ramifications if you do it well, right? So for example, I'm supporting the development of a new neonatal clinic, and another project I'm kind of exploring virtual care within the emergency room setting,
Mm-hmm.
right? So things that touch
Mm-hmm.
obviously a lot of patients. And so, being the lead to be able to, bring all the stakeholders together and to ensure that, everyone is kind of working, uh, optimally and to the best of, what they can bring. That's really rewarding, and to see the finished product at the end of the project. So, yeah, a lot of opportunity to make, wide scale impact. I think that's, yeah, what
Yeah.
kind of keeps me up every day. So.
No, that's great. And I think something that you said that is probably really important if you are thinking about project management, is that you probably have to like change,
Mhm.
which not everyone likes change. So I think that's a good, like, if you don't mind having, it feels like you have new teams all the time, I'm sure, and you're working
Yeah,
with different people and totally different areas. So I
yeah,
think that's actually a good thing to kind of check in on yourself if this is an area you're thinking
yeah,
about. And you don't always know it until you try it. So
yeah,
um,
absolutely. Yeah, no, that's a really
sometimes,
good point. Yeah, it's
yeah.
funny, and I'll expand on change a little bit more here. Totally echo what you say. You have to be okay with change in your role as a project manager, but also it's kind of funny because you should be an expert in change management as well, right?
Hmm.
Helping others, um, understand the change and being able to, apply the change and reinforcing people when they do change, right? That's a huge part of your job as a project manager as well.
Yeah.
So there are frameworks, courses that you can take to understand a little bit more in terms of how to be a good change practitioner.
Yeah.
But yeah, it's helpful because you can apply some of what you learn about change management to yourself as well, right? How can I
Hmm.
get myself to be comfortable with change while
Yeah.
I get other people comfortable with
Yeah.
change, right? So yeah, you can even apply a little bit of what you learn to yourself, or to even to your friends and family.
For
For example,
sure.
some people say, "Oh, my kids don't want to, eat their vegetables," right? So then, how can I approach this from a good change management perspective, right? So yeah,
I
a lot
love
of
it. Yeah.
applicability to yeah, your personal life as well.
Yeah, for sure. That's awesome. Are there any like courses or programs, like I know you've already done a lot of like advanced training, anything that you're kind of working on now in that space?
Yeah, not a heck of a lot, to be honest. Like, I'm always a firm believer that the best learning experiences are through the actual work that you
Yeah.
do, through through work, through volunteering and whatnot, right? Rather than a course. But
Hmm.
I would say that courses are still super super helpful, right? So yeah, I have my project management professional. I also have my certification in being a Scrum Master, my CSM,
Oh,
and
cool.
also yeah, just some change management related certifications too. So I think one, they help you speak the lingo, right? If
Hmm.
that's kind of the gold standard in terms of your area of work, then yeah, being able to, you don't have to know it in depth or anything or memorize the whole textbook, but being able to, yeah, understand the terminology and kind of understand what people are referring to at high level is really helpful. But
Yeah.
obviously, it's good foundational knowledge, and it does obviously, help when you're, looking at making a shift, right? People show that they have that they took the initiative to be able to do a certification like this, right? I think
Hmm.
that speaks a long way when people are looking to make a shift, and managers
Yeah,
are looking at resumes and whatnot, right? So
for
yeah,
sure.
that's kind of the biggest reasons why I wanted to do them. And yeah, I'll always maintain that they're never they never contributed to, I guess, the person that I am, or they had a huge, um, that he had a huge impact in terms of my career, but they definitely helped, right? I think the other things
Hmm.
that will make you, strong in your area are the other things, like how hard you work, and
Yeah.
how much you're willing to soak in during the challenging times, and how much you're able to learn during the actual work opportunities that are presented to you. So
I think that's a really good point because let's be honest, like not everyone can allocate funds if their employer isn't,
mhm,
assisting them to go back and do an advanced degree or some, of the certifications. So I think you make a really good point to say there are a lot of other learning opportunities from on the job learning, and connecting with people within your organization. And even sometimes there's programs offered within your organization that you can take advantage of that are paid for or free. Like exhaust all of those things because yeah,
exactly.
they can be amazing learning opportunities as well.
For
So
sure.
yeah.
Absolutely. Yeah.
Yeah, if there was one thing you could share with your early career self, what would that be?
I would say just be willing to embrace the challenges. Obviously, there are moments in your life where you want a little bit more of the predictability, and just take things a little bit slower, and that's totally fine. Obviously, I need those too, but I
Hmm.
think when I have these periods of wanting to learn a little bit more or whatnot, but sometimes the fear, may hold me back a little bit, right? In terms
Mm.
of, really putting myself out there. But yeah, what if you have that desire to, to make a shift, or to, to really learn something new, then yeah, the best learning opportunities typically come out of, challenging situations, right? And it may be difficult, but at the end of the day, you'll be better for it, with the skills and the tools that you're able to take away with you. But also, people recognize courage, right? And people see it. So those people will become your greatest advocates, and they will
Hmm.
ultimately be a huge factor in terms of helping you get to where you want to go, right? Not only in terms of
Hmm.
that mentorship aspect, but also with referrals, or with
Hmm.
the networking that takes place with doing the work, with these people, or under the oversight of these people, right? So yeah, I'd say not everyone has that, I think, courage to take that
Hmm.
step forward, and throw yourself in challenging situations, and to be vulnerable with yourself, and say, you know what, these are the skills I'm lacking, and here's the skills that I need, and here's how I think I'm going to get there, and here's the people who can help me get
Hmm.
there, right? Those really hard reflections, are necessary, I think, if you really want to challenge yourself, and explore other opportunities in your career. So yeah, just I would say to my younger self, yeah, just be prepared for what's ahead, but it's all going to help you in the end, and try and do it with a smile on your face as much as possible, because it's only helping you, really, in the long run.
Yeah, that's amazing. Yeah, I think there is so much power in taking advantage of the situations that you're in to create your network too. Like, when in any role that you're in, start connecting with people, your managers and leaders, add them on LinkedIn, things like that. That
Mhm.
is really useful in terms of how you can grow your network and look and find those new opportunities. So
Right.
yeah, I
Yeah.
think that was a
Absolutely.
great one to mention. Yeah, well, before we wrap up, is there any other advice you have for our listeners?
Yeah, I'd say, if you're looking to make that shift, I often get asked, oh, how do I go from, A to B, right? And truthfully, there's no linear path, right? And it's not easy. And I'll share with listeners that you know maybe my expectations were a little high, postmasters, where I thought, okay, you know what, I'm gonna, I'm a dietitian, I have a solid job, and then I'm going to do my masters, I'm going to be even better from my masters, and I'm going to be in this role where yeah, I'm making a lot more money, or I have a lot more responsibility, X Y and Z, and and you kind of pump yourself up that way. But at the end of the day, you are making a shift, and it's hard, right? There's
Hmm.
obviously you have this podcast because there's quite a number of people wanting to make that shift, right? And
Yeah.
so, the job market is not always easy. So, for myself, I had to, take an internship role and, kind of slowly build myself up to, get into the role that I'm at right now. And it took some time and took some energy, but, it was all obviously worth it in the end, right? So, I'd say if you're, a dietitian, or if you're a pharmacist, or if you're a student, right? If you're in the internship, obviously you have your day-to-day responsibilities, but I would say if there's an area that you're interested in, such as project management, you can say to your manager, or to your practice lead, like, hey, like, I'm really interested in this opportunity to grow my project management skills. Are there any small projects that you kind of have going on that I could support you with,
Hmm.
right?
Hmm.
Um, I did some light reading on what a project manager does, and I think I can use tools such as a work plan, or a charter, or a risk log, and I can help you keep organized in terms of your project, and make sure that we ultimately arrive at a deliverable on time and on budget, right? And you can make that little spiel to your manager, or to your practice lead, and then maybe they don't have something for you, but maybe they do, right? And
Yeah.
that way you get to practice your skills on a small project, in a safe
Hmm.
environment with the oversight of your manager or your practice lead. And then yeah, you hopefully uh, they recognize the work that you do, and then you're able to put that on your resume, and then through you know continual learning, and networking and mentorship, then you're able to apply that, and get into a project manager role, right?
Yeah.
You don't have to take the path that I did, right? I'm not going to lie, you definitely don't need a MBA to be able to do the work that I do, right? And or you don't need a master's in my opinion, right? It helps, but in terms of the actual content that you learn during your masters, you can learn the project management side of things outside of it too, right? So
Hmm.
yeah, you don't have to follow my path, obviously. There's a lot of different opportunities out there, but and different avenues, but as long as you, I think, start simple, and yeah, start asking for opportunities in your current role that align with your future
Hmm.
goals. Request a lot of feedback, and then keep doing that, so that yeah, it gives you a better chance for when you apply for future roles that you're interested in. So yeah, I'd say that's probably
Yeah, that's great
the biggest
advice.
one. Yeah, and then if I may just add one more too, I
Hmm.
think begin attaching yourself as much as you can to people who can support you and mentor you and provide you with opportunities. One of my mentors said to me that it's not so much the area of work that you're in, or the work that you're doing. It's more so finding the people who will nurture you and provide you with those opportunities to grow, right? You
Hmm.
can always, once you develop that skill set, once you have some things on paper on your resume, then you can always make that leap into the area that you're really interested in, right? But let's say
Hmm.
you get um, to my former example, you get assigned a mini project that you don't love, but at least the support network is there, right? Then
Hmm.
that's more important than finding that project that is gonna that's gonna knock your socks off in terms of how exciting it sounds and whatnot,
Yeah.
right? So it's the people that matter the most
Mm.
in your early career, rather than so much the actual, um, let's say, the specific project that you're doing,
Yeah.
right? So yeah, so I'd
Oh,
say those
I
are
love
the,
that.
the two
Those are
biggest things.
great.
Um, and yeah, and maybe I'll end off on a final note too. If you want to practice your project management skills too, is technically anything's a project, right? Whether it's a
Hmm.
home renovation, or whether it's planning a wedding, right? So
Yeah.
if you can, yeah, use some of the tools and frameworks that that are available in the project management world, and in the change management world as well, then then yeah, you're already getting real life experience in terms of being a project manager. So yeah, be creative because there's a
Mhm.
lot of opportunities to develop your project skills.
Yeah, for sure. No, I think that's great. I think there are, like you said, so many small opportunities in both any role, but also life that you can kind of explore that path if that's something you're interested in. But
Mhm. Yeah,
yeah, no, that's great. Thank you so much, Timothy, for joining me. And I hope everyone's kind of feeling inspired by, our discussion today. So I'll
yeah.
just wrap
For
by
having me.
mentioning a couple of support tools. So, if you're looking to try and make a career transition to something new, I have the Beyond Clinical Career Transition Program, which is a combination of courses and coaching and support with your resume and aspects of finding roles. If you're someone that's recently transitioned into a new role outside of clinical, I also have a network and membership program. It's a small group that we meet monthly and just kind of do like small group coaching. And you can find out more about both of them by looking at the links in the show notes. So, yeah, thanks so much, Timothy. I really appreciated our conversation, and I hope everyone has a great rest of your day.
Yeah, thanks, Alexis. That was a lot of fun. Thanks for having me.
Thank you. Bye.
Bye.